Umbilical hernia is a defect in the abdominal wall that develops right by your belly button, where your blood vessels used to go in when you were in your mom's uterus. What happens is the area over time will open up and can cause pain. It's usually pain right at the site, and you'll notice a bulge at the area. So if somebody comes in with a small outie belly button or umbilical hernia, what it is, if it's not causing them any pain, we talk to them about symptoms that they need to watch for, and they don't need to come and get it fixed at that point. And as a matter of fact, we'd encourage them not to. When it becomes a problem or they start having pain, then it's time to get it fixed surgically. The treatment options when people come in are either laparoscopic repair or open repair. Depending on the patient's previous history, we decide which one would be best for them. And what we do in either case is we fix the hole with a piece of mesh to block the hernia from coming back. The good news about fixing belly buttons is that the vast majority of times we have you come in, we fix the hernia, you go home that same day. A few days later, you're feeling good, and it'll never give you troubles again.